frown for me. And measure your eyebrows up. And then big smile. Perfect. Okay, so I've marked up 3 areas on our client here. As you can see, the spacing, you do get, the toxin will disperse around 1 centimetre. So you don't need to do your marking up overly close together. So you can clearly see here, I'll just tilt towards the camera, the marking up and the distance that we have. So when we're marking up, we do need to consider some safety margins. The first one that we're going to talk about is around the eye. So you must make sure you can use your finger to place your finger whilst you're learning and you're new to this, at the corner of the lashes and up to the tail of the eyebrow, and your marking up must be outside that finger, and that is for safety. So you can see here that my marking up is outside the finger width. When we're injecting the eyes, I will go down and away from the eye, which I'll talk about separately. In addition to that, there are certain things we need to consider when we're marking up the forehead. The closer you are to the eyebrow, the more likely that the brow will feel heavy to the client. If you are doing a treatment where the client already has heavy eyebrows, I would definitely start higher on the forehead when I'm doing this treatment, because just by you freezing the forehead and them not being able to raise their eyebrows makes them feel heavier, but it's just because of the lack of movement. Usually, if I haven't treated a client before, when I'm treating the frown, I will do the procerus muscle and the first one here on the corrugator, and I will not go any further along the top of the brow. Again, that is just to see how she reacts to this and to prevent any feeling of heaviness on the eyebrow. You can always at your review put some more in if you wish, but you need to be careful not to go past the arch of the brow. As soon as you get towards the arch of the brow and out towards the tail, anywhere that is within around 2 fingertip distance will usually present itself with a heavy eyebrow. So that is what I call a no-go danger zone above the brows here, and I will never inject there. Some injectors do, I personally never have, and it is very, very rare that we'd ever get somebody with the feeling of a heavy brow. Then what I've done here is I've worked my way across the forehead, working with the muscle movement, and you will learn that in your practical training in the academy. All the way up to the hairline, we're basically going wherever there is movement, because once you've stopped movement on one part of the forehead, for example, if you leave some, say, higher up, that will become very obvious when the rest of it doesn't have any movement left. So when we're injecting, I always get the client to close their eyes. With it being a toxin, we don't want any of that product to drip and go anywhere near the client's eyes. So for safety, always have the eyes closed. I usually would suggest starting with the crow's feet, just because the needle is at its sharpest at this point, and that can be a more sensitive area. So when we're injecting here, again, this isn't a rule, this is my recommendation. I would always inject down and away from the eye in this position. That is because the toxin is a liquid and it can move through the tissue plane. Obviously, if we're injecting up towards the eye, it might go into a zone that we don't want it to. So it's just for an extra safety precaution, down and away. When we're working here, you need to work quite superficially. It's quite vascular here in the temporal region, and if this does hit a little vessel, your client will get a bruise. So we want to work quite superficial, we want to stretch the skin, and we want to look through to see if we can see any vessels that we actually can avoid when we're doing the treatment. Unfortunately, you will have instances where you will hit one that you've not been able to see that is there and is present. And if you do get a bruise, it will just go down on its own, but obviously we want to minimise the risk as much as possible. So I'm just going to tilt my client's head a little bit towards the opposite direction. I'm going to stretch and look through the skin. I can see here, this is probably just a bit too close. So I'm going to alter the position of that marking up so that we don't hit that vein, because it will cause a bruise. So stretch on the skin, and you're only putting about 1/3 of the needle in, okay? You're not going in any deeper than that. It is not necessary. And I am going to put in here 3 units. Units you will discuss in your practical training. It is different for everyone depending on their muscle movements. That's not something we're going to cover now because every single client is different. I'm going to repeat this here. And then this one, I'm just going to slightly reposition in the hope that it doesn't cause a bruise. And there we go, there's no bruise. You would know straight away because it would come up immediately. I'm then going to repeat this at the opposite side. So if you just tilt your head towards me, thank you. And then after that, it doesn't matter whether you do the frown or the forehead first. I'm going to move to the frown. So for this one in the middle, I'm going to place my finger on the client's nose so that you're always supporting the injecting hand. And this is the only one that you go in at a 90-degree angle, and you can go a little bit deeper as well. When we're treating the corrugator, there are other things that you can do to try and prevent heaviness on the eyebrow. Always make sure you're 1 centimetre above the brow bone, and you can pinch the muscle up with your free hand, support the injecting hand and come across, and I'm about a 45-degree angle. We are also working very superficial here. You do not want to be putting that full needle length in. You will cause a heavy eyebrow by hitting the underlying muscles. I will then obviously come to the opposite side to do this one. You just tilt towards me a little bit. I'm just going to pinch with my free hands and come across here. Then when we're treating the forehead, you can't really go too deep here because it's quite a bony area. We're going to work all the way across. For the ones that are above the arch or out towards the tail of the brow, I would never put more than a 2 or 1 unit there, just because this causes lift on the brow, so you don't want to risk causing a drop. And I am just working my way across the forehead. You can stretch with your free hand. Usually the skin on the forehead is quite taut anyway. So this entire row, first of all, and then the top row. We're not pressing on too firmly, we're just giving the area a wipe. And that is our treatment done. We don't have any bruising, minimal spotting, and not too much discomfort for the client. So just to recap, when we're injecting, we're working at a 45-degree angle pretty much everywhere other than the procerus muscle where we're going in at 90 degrees. When we're injecting the eyes, we're making sure we've got our safety zone. We're injecting down and away from the eye. When we're injecting the corrugator muscles, we are pinching with the opposite hand and we're standing at the opposite side to where we are treating, the same as the eyes, coming across at a 45-degree angle, superficial, pinching the muscle belly, and then the same at this side. Forehead, we're going to work our way across, 45-degree angle. Can't go too deep in this area because obviously it's quite bony anyway. And just remember that around the eyes you must work nice and superficially as well.